thank you for joining us today. We're here to talk about EZZ Life Science. Now, this is a company that listed almost a year ago on the 3rd of March 2021, and it fortunately has a very simple ticker to remember, which is EZZ. The company continues to launch new products and has a pretty exciting pipeline ahead, but today we're going to focus on two most recently launched products. Firstly, there is the EZZ Biotic in Gastro Capsule, and secondly, the EZZ Biotic HHP Support Probiotic. Now, to join me today to help me discuss these, I am lucky enough to have Professor Lewis Vitetta. Welcome,
Hello.
Professor.
Thank you.
Brief note on Lewis, he has a long background in the industry and also a clinical professor with the University of Sydney. And Glenn Cross, who is the recently appointed chair of EZZ Life Science. Welcome, Glenn. Also another industry veteran who's had more than 4 decades of experience.
I love the industry veteran bit.
4 decades of experience and was also part-time, for a period of time, the Chief Executive of Oz Biotech. So thank you so much for joining me today. Now, before we delve into these products and hear about those, Glenn, let me just ask you if you can, in a nutshell, tell us what EZZ does.
Sure, thanks Gemma. EZZ is a ASX listed life science company. We listed in March 2021. We have a range of probiotics and nutraceuticals under the EZZ brand, but in recent times we've made a commitment to transition into more of a genomics company. Two general areas we're focusing on is around well-being and weight management, but we decided initially to look at two disease areas, one being Helicobacter pylori, H.Pylori, hence the release of these two products, and we're also looking at products for another disease state, HPV, which is a human papillomavirus. And then as we progress through the next few years, we're looking at a few other opportunities, but really focusing on this more personalised medicine, which is what genomics is about. So you'll see a lot more genomic-based and personalised product coming out of the EZZ range.
Excellent. So well-being products that are tailored to your own personal needs.
Yes.
Is what we should expect from EZZ. Excellent. You mentioned H. pylori. I don't want to use too many technical or scientific terms here. We want to keep this accessible for everybody, including myself. But I think it's really important before we go any further to understand what this is. Lewis, could I ask you to explain simply what it is, please? Okay,
well, H. pylori is a bacterium. It's one of about a dozen bacteria that can actually cause cancer. Okay, so and this is a very interesting bacterium because it has a number of structural features that causes it to burrow through mucus, possibly in the stomach, and can actually initiate a cancer, a gastric cancer. So it's a serious infection.
Now, I've never heard of it until recently, and I'm probably not alone in terms of our audience. How prevalent is it?
Well, look, the studies tend to report that the prevalence is somewhere between 30 and 50% of adults of a certain age, of middle age onwards, are subject to being infected with this bacterium. So it can become a very serious problem.
Is it something that is obvious, Glenn, if you have it, or is it difficult to know?
Well, if it ends up in a disease state, you know. We used to call it ulcers many years ago, and then they finally, through a doctor in Perth actually, Barry Marshall, who first identified that people weren't getting ulcers from food and from stress and all these other things. It was actually a bacterium that was causing it, the bacterium being Helicobacter pylori.
Right, so anyone who's had an ulcer would really understand what we're talking about here already.
Yeah.
Lewis, let me go back to you for a minute. Now, I'm sure there have been treatments around for a while, until recently when EZZ launched its new product. Tell me about the backdrop to what treatments were available and what people tended to use.
Well, look, the treatment that is commonly used is the triple antibiotic therapy, okay, which is efficacious, all right? But when you load the body with a triple antibody, it will disrupt the gastrointestinal system. And so creating a probiotic formulation that goes hand in hand as an adjunct medicine to the triple antibiotic therapy makes a hell of a lot of clinical sense, because what you're trying to do is trying to protect the gut from further damage from the triple antibiotic therapy that is being utilized, administered to clean the infection or to clear the infection. So it makes a lot of sense to use the probiotics in that manner. There are a lot of reports associated with the co-administration of probiotics, multi-strain probiotics, in order to protect the gut when patients are being administered and prescribed an antibiotic for some sort of infection, for an infection, a chest infection of some sort or a gut infection of some sort. It's a very good practice to also prescribe a multi-strain probiotic in order to protect the gut.
Glenn, talk us through how EZZ came up with this idea, and that's what was missing from in terms of treatments available for H. pylori and people who were at risk of suffering from this.
Well, we identified it as a common and an extensive problem. Lewis mentioned 30 to 40% in some of the Western countries and places like Australia.
Up to 50%.
The incidence is even more in China.
Mm-hmm.
You know, I've read reports of up to 60 to 70%. So we identified it as a real problem.
And let me interrupt. Can anyone get it, or is it a genetic likelihood of contracting it, or is anybody at risk?
Anybody's at risk, yeah. So we identified it as a real problem. And then with Lewis's support and help, we formulated the two products.
Okay, fantastic. And it's such a trend to look after your health and well-being. There are so many products on the market now. There's a pill for this and a powder for that. And how easy is it to incorporate this into your daily routine and your daily life?
Oh, very easy. Look, as you say, Gemma, there's a lot of products. The story about incorporating a probiotic, it can readjust the gut that is associated with imprudent dietary practices, lack of physical activity, everyday stresses of life that changes the metabolism of the gut and gives you a little bit of bloated gut, and you don't feel right, you don't sleep well. And so, inserting a multi-strain probiotic like this one, especially if you're under a treatment for Helicobacter pylori eradication, makes a hell of a lot of sense, makes a hell of a lot of clinical sense in order to protect the gut, because that's what you want to do. You don't want to sort of be eradicating H. pylori while damaging the gut. And this formulation is so good because it has the lactobacilli that operate at the end of the small intestine, mm-hmm. and the bifidobacteria and the streptococcus that operate in the initial part of the large bowel, where most of the activity is going on. So that's what you want to protect. You want to protect the gut.
Now, if I was to start taking this, mm-hmm. Glenn, tell me, how would I feel different over a period of time?
Well, I take it.
Good. Tell us how you feel different.
I've had some issues with gastric problems, and I take the HHP 1 tablet a day, and it's worked for me.
It's good to hear.
It's worked for me.
You're here alive and healthy, and well, it's a walking case study. That's fantastic. Lewis, tell us again, like how people should think about it if they haven't had this brought into their lives yet. They're hearing about this for the first time. They're still not convinced that it's necessarily relevant to them. What's your best way of explaining that it absolutely is?
It's very, very important. An unbalanced gut produces inflammatory responses that lead to ill health.
And we're talking bloating, we're talking...
Bloating, like for example, diarrhea. Constipation, broad spectrum antibiotics that cause diarrhea, so you want to recover that, you don't want to be going through all of that. For everyday people, a multi-strain probiotic is an adjunctive to health. I want to maintain my health, I'm going to have everyday stresses, I don't exercise every day, I've got imprudent dietary practices because of the stresses of my job, so I don't eat right. And so you get these ill health sequelae that just put you off a bit, okay? A transient consumption of multi-strain probiotics can rebalance the gut. That's the best way that you can put this.
Let me ask, how long should we expect if we start taking it? It'll take before the gut does move into a better equilibrium.
Starts within 24 hours.
Okay.
Because there are so many different products on the market with one probiotic, with two probiotic, the concentration is different, the mode of delivery is different. Some of them have got a powder, some of them have got a capsule, some of them are tablets, some people I think even make liquids. This has got a lot of science put together. The individual strains have got a lot of clinical evidence from animal models and in human studies to do something.
That's an important point. These products are scientifically based products manufactured under good manufacturing practices. They're registered with the TGA. You have to go through an approval process through the TGA, and it's registered under the Register of Therapeutic Goods. So they are scientific products.
And they're scientific products in response to what is becoming more broadly recognised as a serious issue. I was reading that H.Pylori has been hitting more literature of global organisations recently.
Well, yes. Look, it's an infection that exists. And as I said previously, it's one of a dozen bacteria that can cause cancer. And from that perspective, if one is diagnosed with H. pylori infections, well, you want to get treatment for it, okay? And as you get treatment, the evidence today supports the use of a multi-strain probiotic to protect the rest of the gut. You have to, because you can end up with a triple antibiotic therapy. You can get, in some patients, they may become constipated, others might get diarrhea, others might get abdominal pain, which causes problems for the clinician in treating the patient. The clinicians often opt for making it as easy as possible to treat a patient, all right? And I'm convinced that when you provide an adjunctive treatment like this, it makes it easier for the patients to recover from an infection of Helicobacter pylori, okay, with a gut that is being protected from developing constipation, diarrhea, bloating, abdominal pain, that kind of thing. Antibiotics have been proven to disrupt the gut. And when you disrupt the gut, you increase the risk of bloating, inflammatory problems. One may be prone to having problems with their bowel, and an antibiotic can actually then exacerbate that. So what you want to do is minimize any adverse reactions to the antibiotic. What you want to do is not disrupt the gut with something like this.
Yeah, and in very simple lay terms, Gemma, the antibiotics kill good and bad bacteria. So they kill everything. They're not selective. The probiotic puts good bacteria back again, in simple terms.
That was a very nice, simple way to round that off, but I'm not going to let you go just yet, Glenn. I would like to hear from you what else EZZ is working on. Personalised medicine is such a hot topic right now. Everyone loves the thought of something that can help them specifically and tailored to their needs. So tell us, what else can we expect from EZZ?
Okay, well, we are committed down this genomic track. We're looking at other specific disease states where we think we can introduce functional foods and probiotics to help. You'll see us release another few functional foods over the next couple of months, and then as we progress over the next few years, we're looking at a range of other disease states.
So watch this space.
Yes, indeed.
Okay. Gentlemen, thank you so much for joining me today. I look forward to trying this. And thank you so much to all of you for joining us today as well.